Okay, so the first one, just going back to the program, if we look at, this was with Prof. Mklatlele. Is he here still?
He said he was
the prof here? Because I have a question for him. If he can't answer it, maybe one of the other panelists can.
He is present.
Again, wonderful. Again, I'm speaking from a layperson perspective, but I think it's something that is really not understood, and there's confusion about this in the media and amongst the public. Prof, your presentation was on influenza, and it's not clear for me what the difference is between flu and coronaviruses. So when we speak about learning lessons from flu, there's often a mix, there's often they're often spoken about together. And I wonder if you could maybe explain further about that. Over to Prof.
Prof. Mklatlele?
Yeah, I was out for a minute and I came in the middle of the conversation, but I caught the tail end of it. So you need an understanding of the difference between influenza and COVID.
Yes, please. I think that there is misunderstanding in the public and what is explained in the media. Thank you.
Okay. Well, the most important thing is that the causes are different. Although they are caused by viruses, as you have seen on my slides, influenza is caused by influenza virus, and COVID-19 is caused by SARS-CoV-2. That's the first thing. In terms of clinical presentations, there is a lot of overlap. And this is where you can easily be confused because I guess if we are in influenza season, you may not necessarily tell whether you have got influenza symptoms or COVID-19 symptoms. And I would say that you know the most important suspicion should be on COVID-19. Given that we do have the virus circulating throughout in the community. But the definitive answer will be in the laboratory diagnosis. Unless you do lab diagnosis to differentiate whether it's COVID-19 or influenza, it will remain a confusion. There might be some symptoms clinically, where one can say most likely is COVID-19, like shortness of breath. But in terms of fever, you know, muscle ache, tiredness, and all that, you get these things in both flu and COVID-19. So that's what I can say for now. Obviously, the most important thing, if you want to get confirmation whether it's flu or COVID, is to do lab diagnosis.
Thank you. Then just a question around that. So is just one more question around how the public perceives this. Then is having a cold the same, is a cold considered a coronavirus?
Correct. So there are a lot of coronaviruses which are the causes of common cold. And in fact, one of the distinguishing factors between common cold and influenza is that with flu, quite often, if you get a fever, is quite, rapid onset of fever. And then when you have got cold, you can get fever, although in most of the cases, you may not necessarily get fever. So coronaviruses generally, symptoms would be mild. And I'm not talking about the SARS-CoV-2, the cause of COVID-19. I'm talking about other coronaviruses that we have. So yes, generally cold is associated with coronaviruses. But then influenza is associated with flu, which can be complicated in some patients and then you get lower respiratory tract. And coronaviruses quite often, they stay as upper respiratory tract infections.
Right.
Okay.
I know these are very simple questions I'm asking, but I do think from a public perspective, they're important, and I hope you agree.
Yeah, and these are from the perspective of a virologist, these are things that I can say. But if you ask a clinician, obviously it might be that the approach will be slightly different. But from my side, this is what I can tell you.
Okay, then it appears that there is, I'm not sure if this question is for you or I can go on to the next question in the chat. Gabriela asked, is there correlation? I'm not sure, Gabriela, is this for the prof or for, is there any correlation between COVID-19 and premature deaths of babies? Prof, I'm not sure if that was for you. I think it must be.
I don't have a good answer to that question. First of all, even if SARS-CoV-2 can infect all ages, is less common in the younger age group, especially in babies, but they do get infected. And there was 1 or 2 cases at the beginning of the pandemic where premature babies were found to be positive with SARS-CoV-2, but I wouldn't really say this is this means that you can make a correlation between premature babies and COVID-19. I don't think there are a lot of cases, and it was probably coincidence that there was detection of COVID-19 in those cases.
Thank you. I do want to point, and maybe we'll have time later to go through them verbally, that in the Q&A, the prof answered a number of questions. I think about 3 or 4 questions that were posed to him, and hopefully we can go over those verbally afterwards. But in the meantime, the questions that haven't been answered as yet, if I can now just go to Prof. Anneliek.
Hello, I'm here.
Hi.
I'm going to switch on my camera because as Vanda did, I also put on makeup and got dressed for the occasion. So hello, everyone.
Hi.
My camera is not on because I do not have makeup on and I'm dressed for the occasion. Okay, the question, I know we've already asked you about the different layers and you responded very nicely to that in terms of how people can understand why around foodborne viruses. But the question I have, the question that I have for you is, you made a point on your slideshow where you were explaining that the death rate is low because we have such a high number of infections.
Yes.
Now, I feel again, I'm focusing on the confusion that exists amongst the public. That issue of death rate, I think, has caused a lot of consternation because people believe it isn't high enough to result in the type of laws that have been created around COVID-19. Could you explain how that works, the death rate to the number of infections, and why this is considered a pandemic and so important, etc.? Over to you.
Okay, so basically, not being a clinical microbiologist, those figures that I presented on that one slide were simply the known number of infections versus the known number of deaths. So people who've recovered or unknown deaths that might have been attributed to COVID-19 but was never logged as a COVID-19 death. That, unfortunately, we don't have that data. So it was really simply just taking the number of infections versus the number of deaths, division, and then you get a percentage death rate. But yes, in the clinical space, there are various other ways of determining those kind of percentages. But I did a very simple calculation based on WHO historical data from the MERS outbreak as well as the SARS outbreak. And then I did the same for the SARS-CoV-2.
Thank you. I think the question I'm asking is, maybe I didn't make that clear from my side because of the misunderstanding in the public and myself.
Right.
When we hear about the words about a pandemic, we all expected a much higher death rate.
Yeah.
Even though the US has a high death rate. So I think there's a confusion as to why we're going under these incredibly stringent conditions when the death rate is so low, and yet people are saying, oh, we can't cope, this is not happening. And there's so much space there for misinformation to come in.
Yeah.
So that's what I'm trying to understand is the low death rate. Thank you. Over to you.
Right. No, thanks very much, Debbie. I'm afraid I will not be able to answer that question. I would rather leave that to the virologists and the clinical microbiologists and virologists who are actually dealing with the pandemic versus the regulations and all the shutdowns that have occurred and the lockdowns that have occurred across the world.
Thank you. Is there someone on the panel that can answer that?
I didn't pay enough attention when you were asking the question.
Oh, that's great. Can I ask it again?
Yeah, you can.
Firstly, thank you to Prof. Annelich. Prof, Prof. Mphahlele, you wouldn't think Ngikhuluma isiZulu, but sorry, I'm just having an issue with the names. The understanding there is a relatively low death rate. I mean, even one death is terrible, but there is a relatively low death rate when one considers the notion of a pandemic. I'm speaking about the general public, not the academic community.
Yeah.
So you have this high infection rate, you have this low death rate. There was all this information that was passed on to the general public about how this is a pandemic, how we need all these very strict rules and measures that we need to be put in place. Yet the expected death rate seemed to be very low for what we are supposed to do, from the lockdowns, for the strict measures that have taken place. Is the public misunderstanding? So there's high infections, but this relatively low death rate. So the question is it not a relatively low death rate? I mean, I think people expected millions upon millions upon millions.
So it is actually a blessing that the death rate is low. I don't know why they feel alarmed if the death rate is low. But you have to realize that when you calculate the death rate, it depends on a number of factors. It depends on whether you are doing enough detection in the community, because a lot of infections are asymptomatic. So if you were to include that, actually, you will find that the death rate is even lower. What I'm saying is that the death rate of SARS-CoV-2 is not comparable to the death rate caused by MERS coronavirus, for example, because we know, I'm sure Wanda can attest to this, that with MERS coronavirus, the death rate is quite high. So SARS-CoV-2, you've got a lot of people. You have a lot of people dying simply because it's able to infect a lot of people as well. But then the fatality rate is low, generally speaking, compared to other SARS or other respiratory infections in that category. If you look at SARS and if you look at MERS coronavirus. So I think if the question is really about why don't we see more people dying, then I would say it's good if people are not dying, because we don't want to see a lot of people dying. But if you say, if you want to compare the death rate to to other viruses in the same group, clearly SARS coronavirus 2 is not causing a lot of mortality compared to other viruses in the same group.
Thank you. I think the question was more about the economics.
So maybe can I maybe comment? So you made the question that the public, you made the point that the public get confused because there's not a lot of deaths and then we get locked down. But I think, yeah, but I think one of the issues, and I think that wasn't communicated very well, it's not just about the death rates. It's also about the amount of active cases. Because we're slowing down our health system. So just looking at that 2 or 3% and saying this is how we shouldn't be in lockdown if there's only 2% dying, it's a much bigger picture that's probably not communicated very well. It's not just about the death rates. And the reasons for that, I think, is going to be unpacked with future studies. I don't think we have the data to say why it looks like less people died in South Africa. There is so many theories that it may be pre-existing immunity, it may be genetic factors that we're now trying to unpack with genomics. So that or it may just be reporting. That may also be an issue. But I think the point that we need to make it clear to public that decisions are not made just on how many people die. There's a lot of other factors.
Perhaps, Debbie, if I may also just come in here from my perspective, I think it's also a question of the responsibility that governments have to protect their citizens as far as possible from such diseases. We can probably criticize government decisions, whether it's our government or the UK or the US. I mean, everybody's made mistakes for sure. But I think it's also a question, as Wanda has pointed out, it's the burden on the health system. It's the burden on how do we deal with all these cases that are coming in and have to be in ICUs for an extended period of time. And how do we prevent other people from getting sick? Because, we all probably know someone, or unfortunately might have lost someone close to us. So the question has to be raised. How far does a government go to say, well, we're not going to do anything. Let it just ride and let people get sick, and those who die, die. One can't, you also can't take that route. So there has to be a balance, and it's a difficult balance to maintain, because you don't want to have people getting ill and you don't want people to die in large numbers. Because 2.5 million, we can say, well, that's not a lot. It actually is. It's a lot of people. And before this pandemic is over, there will be probably many, many more people, unfortunately, who will pass away. So I think governments have a responsibility to take these things into consideration and to take them very seriously.
Actually, thank you for turning the question around, because I just didn't understand it from the word go. I was focusing more on the death rate, but actually is about the lockdown. Why do we have to have a lockdown with less people dying? I think that is actually the crux of the issue here, and you have answered it very well. The socio-economic impact of the virus to the society. Thank you.
Thank you so much to everyone. That was a great answer. I do have more questions. Yancy, is that okay?
Yes, that's fine, Debbie.
Okay. I'm just want to make a comment here from Guy Preston, who said, surely it's also what the numbers might have been had the measures not been put in place, coupled with the unaccounted for deaths, possibly 2 to 3 times higher than the official numbers, suggesting that the death rate may be a lot higher. Thank you very much, Guy. Please know that I have the information that everyone's speaking about. I'm speaking for the masses and what I've seen in the media that has been misunderstood. So please don't think I'm just saying. Okay, then the question that I have, I don't know if Dr. Naika is still here.
Yes, I'm still
Oh,
here.
wonderful. Thank you, Dr. Naika. I have two questions for you. You spoke about creating a sector response plan from all the issues with in terms of the responses you've gotten from different places, different areas, different sectors so that you could respond to it. This is more of an operational question with regards to questions and information that we discussed yesterday around how collaboration works and how we can be more transparent. In terms of developing this response plan, where will the stakeholders be able to see the progress? Not necessarily the nitty-gritty, but a timeline, and then B, as it goes along, we've gotten to this point, this is the output of this output now. We've gotten to this point. Will that be a possibility? Over to you.
Yes, I think from a government perspective, we are obliged by the legislation to conduct robust stakeholder engagement. But that said, I think this is quite a specialized kind of area of work, and the nexus between these various disciplines, and so it would probably involve a lot of specialist inputs in that process, and then thereafter at some point we would consult the public, because once the sector response is developed in a co-created process of both specialists and governments and practitioners, as well as stakeholders as well, it has to go through a robust consultation process. And in that process, the general public out there is expected to comment and be part of the process. So, I mean, there's two phases to it. There's the development of the process and getting the enough and the necessary evidence to actually support the sector plan. And then there's this process of adopting the sector plan itself. And so in that process, it would be a much more broader consultation process that would unfold.
Thank you, Dr. Naika. I wanted to just ask you a question more. This is more around the IT and communication of the sector plan than the consultation process. Would it be possible to track where the sector plan is in terms of implementation, in terms of creating, when I say implementation, I mean actually developing the plan? Would there be a board that all stakeholders, be it the public or people, the specialists that are involved, that can see we're now at this stage, this is our deadline, almost like a project plan, but we can see what's happening and where it's at? Over to you.
I think your question relates more to, thank you very much. I think your question relates more to the transparency of the process and keeping the public informed. At the moment, I mean, I've been in the process of developing a clearinghouse mechanism of where stakeholders can access, the various projects within the department. And again, there's a lot of policy issues that need to be unblocked before we can actually allow the general public to be part of the co-creation process, as I've been proposing. And so I think in terms of the timeframes, this is a 3-year project in terms of gathering the information, and then all the other technical requirements of the project, and then thereafter the actual publishing of the sector response plan. So I think, I mean, there's various structures within government where we are answerable to the public, and it obviously has to go through to Parliament and through to the portfolio committee, where we actually there's a lot of interest in this whole thing, obviously, because the sector the public wants to know what is happening. And that those are the reporting mechanisms that would happen. But in terms of the actual engagement of the broader public with this process, it may be limited to until such time that the sector plan is developed and then it is published for public comment. So that's the processes that would be unfolding in government at the moment.
Thank you very much. And then there's just one last question. I am checking the whole time to see if anyone else has asked questions. Just as a note, Everest had has posted information in the general chat regarding the death rate and replying to how that works, just to point people to that. And in terms of, and if I can just ask a question, if there's time, to, I think it's Prof or Doctor, I'm just looking over here, it's Prof Makota. It was quite a specialized presentation and very interesting, so thank you very much. But what would you give as a takeaway message more to the general public?
Sorry.
Of your presentation.
So I think if there's a message for the general public and not really what we need to do strategically, it will be really to live responsibly with your environment and the planet, because contact with animals where these pathogens live and things like agricultural intensification and destroying the ecosystem is the things that's going to lead to spillover. Humans are causing spillover, not the virus. The virus is happily living in nature. It's us moving into those areas.
Great, thank you very much. I know my questions have been very basic, but it's specifically to try and clear miscommunications, which can easily come from specialized presentations. So thank you very much.